As described, WASH, water, sanitation, and hygiene, is a sector within international development. And the goal is to make sure that everyone has access to these fundamental rights. So access to clean water, access to safe sanitation facilities, which being a toilet or latrine, and then also access to hygiene being hand washing. So making sure there's soap and water available. And I in particular look at the issue of WASH within the healthcare setting, but you can look at WASH in community settings as well as in schools. So I think we're particularly concerned about WASH in a couple of settings. So first, when you think about WASH in the healthcare setting, there's a concern of making sure that you can practice proper infection prevention and control, IPC. So if you don't have proper IPC, the concern is that patients can acquire hospital-acquired infections or nosocomial infections, which is another name for it. And then they would have to be treated with some sort of antimicrobial drug. So the concern there is the increased use of drugs unnecessarily for preventable infections. Additionally, patients could pick up an infection that's already resistant. And so the concern there that's spreading within a healthcare setting amongst vulnerable patients. But then when we look outside the healthcare setting, we're concerned about the access to WASH amongst the general population. We know that not having access to clean water can increase your vulnerability to diarrheal disease. And so thinking about that, thinking about the spread of these preventable illnesses and the fact that they may become required treatment through drugs. And so they may have to go to a healthcare facility to get treated. And again, the greater use of antimicrobials may increase the burden of AMR, broadly speaking. And then lastly, there's a concern about feces and other pollutants in the environment, and the fact that may make it more conducive for greater resistance amongst the pathogen. So here we don't necessarily have the same infrastructure challenges. You do see most facilities have running water and backup water systems, toilets are functional. I think my biggest concern in healthcare facilities is the practice of hand washing. We know doctors are incredibly busy and nurses, but being able to practice proper hand washing at the key moments. So for example, before touching a patient, after touching a patient, before any sort of procedure, you want to make sure that these practices are happening regularly. And that's really difficult, we know, with as much demand as there is on healthcare workers, but certainly in the US, that is a concern. We know everything's interconnected. If anything, this pandemic has taught us, it's that one thing happening in a country what seems far away is still going to have an impact on us here in the US. And other high-income countries, not exclusively us here. So if you have healthcare facilities or even communities that don't have access to water and sanitation and can't practice proper hygiene, you could have an increase in infections, and specifically antimicrobial resistant infections that then spread to, they could be transmitted through people traveling to the US, and then those infections spreading here as well. So we don't have borders for pathogens. There's no passports. So certainly a concern to make sure that we're only as strong as our weakest link here. So making sure that there's good practices of hygiene throughout the world. So there's a couple roles in which healthcare workers can play. One of which is that they can help demand services. So the role of the doctor, the nurse, the midwife, they have powerful voices. And so not only within their own facility, but up the food chain, thinking about others in command, using their voices to say that this is an issue for them, for the safety of their patients, for the safety of themselves as they come to work. So I think you cannot overstate the value of the healthcare worker's voice in being part of this. But also, I think we also need to look at how healthcare workers can be influential amongst each other. So demonstrating proper infection control practices like hand washing, being a champion within the healthcare facility, and holding each other to account to make sure that these practices are undergoing day in and day out throughout the healthcare facility. there's a couple ways in which this can be beneficial for the healthcare facility itself. Certainly when you look at patients, you want to reduce the amount of hospital-acquired infections because that can lengthen and prolong the amount of time a patient stays in a healthcare facility, which can become costly. So reducing readmittance rates as well, both of which can have a burden on the healthcare facility's bottom line. But more than just that, we also have seen studies that have shown through healthcare seeking behaviors, women are less likely to visit healthcare facilities with poor water sanitation and hygiene conditions. So as that is a deterrent, we've also seen programs that have undertaken WASH programs, and these healthcare facilities have found that over the lifespan of the program, patient intake doubled, deliveries doubled, and revenue tripled. So financially, there is an incentive here to ensure that you have good WASH services for your patients, and then perhaps as well for the staff. I don't know any study that specifically looked at this, but I have heard working with midwives and doctors, there's a concern about staff satisfaction and retention rates of staff, which again, ultimately impact the economics of a healthcare facility. So when we're thinking about a healthcare facility that is fully functioning, that is self-sufficient, WASH is clearly a part of that as you think about that in line with other initiatives like antimicrobial stewardship. If there's anything I hope anyone has learned this year, though it's not a novel concept, it is wash your hands and how important hand washing is. And that is certainly true for the general population, but doubly so amongst healthcare workers. And so that, among other infection prevention and control practices like the cleaning and disinfecting of surfaces, are really critical. And so we hope to see this investment in greater prevention. I know prevention's not sexy. It's not the thing that you want to spend your money on. But I think that we've seen through COVID-19 that you can't just be focusing on reaction, but we really need to be looking at proactively how do we ensure that some of these fundamentals are in place, and WASH is one of those key fundamentals. Well, I don't know if I can predict it. I would say there's some things I hope that we carry on. And as a public health practitioner, prevention is key to what we do. And that's certainly very true when we talk about AMR. So investing in prevention, investing in some of these basic environmental protocols and stopgaps to make sure that we don't have the spread of infection throughout these critical environments like healthcare facilities. I also think that through the pandemic, we've seen greater collaboration amongst sectors. And that's been the biggest challenges for us working. WASH is in its own sector. It's as my boss would say, it's a public works solution to a public health issue. And so we have seen through the pandemic, we're starting to cross those lines. We start to see folks have conversations that perhaps were not as easily initiated prior to the pandemic, but it's really been necessitated due to the circumstances. So I'd love to see us continue to leverage that situation. And then I think there is value in the public awareness around public health. People throw around terms like epidemiology, PPE has become part of our vernacular. And I think there is value in the fact that the public has a better understanding of what these measures are that are necessary, whether it's social distancing, hygiene prevention. And I think we could definitely take that further when we look at AMR to be more engaged with the general public and get them on board with this issue. Well, I think it comes down to a lot of this is partnering with others who have the similar goal. And so I have not heard of many facilities who are really working hand in hand with WASH and antimicrobial stewardship. And so I think it'd be great to have partnerships there to have staff on board and committed to this and being champions. I think champion building is one of the greatest needs for any sort of healthcare facility initiative. If you don't have staff behind it, from the leadership down to the those on the wards themselves, I think you are continually fighting an uphill battle. And so we have seen from the WASH perspective that having key champions that bring this issue forward is really critical to being able to move this issue ahead. And so I think that's something that would be valuable from as we think about meeting the antimicrobial stewardship goals as well. And then partnering with others in this space who are looking at prevention and looking at some of these larger threats down the road.